It's good to be here in London visiting with you all for the Digital Health World Congress 2017. I'm David Vinson. I'm the founder and chairman of DHX Group based in Austin, Texas. And we're one of the leading advisory firms for helping large healthcare establishments accelerate the adoption and deployment and implementation of digital health innovations. So mHealth curation, as a cure for what I've called Apageddon, is a process in which we are encouraging the marketplace to undertake as it relates to how to filter through the veracity of healthcare apps that are now out on the digital health landscape. In 2014, there was approximately 97,000 health and fitness apps in the iOS and Android store. Today, that number has now surpassed 259,000 applications. We see a significant growth in the supply side, but a slowing in the demand side. So my question to the marketplace is, do we need another app in the way that we've designed and created apps today, or should we look at the approach and reimagine how apps can be a much more of an integrated part of the experience journey with consumers as patients, as members through payers, and also supporting their interaction with their clinicians relative to the encounters of healthcare? Well, as a serial entrepreneur, I've been around probably the last 25 years, investing, supporting, leading several different organizations. I'll focus on two of three primary companies that are active today. We won't get into the weeds of other companies that are emerging, but we're focused on two right now as we transition from an existing company that we're moving away from. Actually, we have that company being purchased right now. So DHX was started as a nonprofit organization to help bridge some of our commercial intellectual property in collaboration with academic centers of excellence. So one of my early success projects that I was involved with at the University of Michigan, where I was the senior vice president for mCare there in Ann Arbor, Michigan, was collaborating with the scientist by the name of Dr. Vic Strecker. We were one of the first tech transfers at the University of Michigan Health System where we were able to harness some of our academic center of excellence IP, create a commercial enterprise called Health Media, built that business up over 10 years, and had a nice exit to Johnson & Johnson. Learning from that experience has inspired me to continue to build a bridge between what I call research-driven innovation. Finding these centers of excellence that are not so much like startups, but organizations and cultures where they're fostering the next generation of disruptive thinking. And I find those to be, for me, academic centers of excellence. So today, DHX has formulated 4 partnerships with academic centers of excellence in the US, where we have the opportunity to be exposed to some of the next generation thinking from young millennials, master's level students, professors, and in certain cases, we are presented with the opportunity to consider some of the following. One are tech transfer opportunities. One is co-creation of commercial projects and products where we work with those academic leaders to help those products on their acceleration towards commercial opportunities. So it's a blend between finding the entrepreneur who's on the front line of market demand with the thought leader who's thinking about, could this be disruptive, but really doesn't understand the market forces of business models, distribution requirements, pricing opportunities. We marry those two up, go and find what I call test and learn environments for those academic-centered areas of innovation, and then when we find a successful deployment, we can then together accelerate commercialization from those partners. So that is what DHX does today. One of the examples that we undertook in 2016, we recognized that our commercial business, which was one of the early pioneers in helping large healthcare organizations in the US curate apps, was we had our own proprietary set of guidelines that we were using to curate those apps. Often we would receive a little bit of market flack that, well, you're the software company, but you're also the guidelines measurement company. And so we recognized that it was time for us to help the industry try to accelerate. So we did two things. One, we acquired one of the other early pioneers in app curation that was called HATTEAC, which was started by the Greater New York Hospital Association. We acquired the remnants of that organization in the fall of 2014. Their initial focus was on prescribing apps through physicians at the point of care. My commercial organization, Social Wealth, was focused on helping large healthcare sponsors or payers recommend apps to members or employees through their member portal. We wanted to fuse those together to bring about an integrated experience between the point of service through the payer and the point of care through their healthcare provider. Because we recognized the opportunity that the market was shifting from passive digital health to prescriptive digital health. Now, to separate our work in the software realm, we took the guidelines and we went out and looked for industry-leading meta brands who had industry credibility. organizations that now have joined me through the creation of a nonprofit 501c3 organization named Excertia. I then formed with my 3 co-founding organizations of Excertia, the American Medical Association, the leading trusted voice for the voice of the physician, the American Heart Association, a trusted meta brand for the credibility and science elements of health content and information, and third but not least, the Health Information Technology Influence Body in the U.S., and that is HIMSS, that's both domestic in the U.S. as well as international. Those 3 meta brands, certainly well beyond what my small entrepreneurial ventures could have gotten in a global reach, have brought the industry credibility to now put their support, reach of this effort of saying, can the industry, in some ways, develop a little bit of a structure around how apps should be developed and then deployed to the market from the lens of the patient, the physician, the technology company, and centers of excellence and government as well. So Excertia, I think, is on the forefront of being an open collaborative where at least there's one area that is the first start in this endeavor around apps that have grown from 97,000 to 259,000. We think we'll bring some structure to the market around this in a very collaborative way where multiple parties can benefit. No one party will reap the rewards. It's open. And that's why we brought Excertia to bear. So we're pleased to be a part of helping us spawn it. We've been at it for almost 3 years. And often you'll say that we were early, but we weren't wrong. It's just the market has finally come around and said the timing is now, and thankfully our partners are giving us the opportunity to stay engaged during that time. Well, I think there's a few points, but I'll focus on one, and if my black box had the total solution, I'd probably package it up and market it to anyone who's interested in learning, but let's be open here and share a perspective. From my viewpoint, in learning from some of my experience that I gained while in Las Vegas, a city known for great experiences, and the notion of gaming. When this notion of value-based care was repackaged in healthcare, where they were talking about risk shifting and aligning costs to drive quality improvements, there was something missing in that discussion of value-based care, and that was the voice of the consumer. And I then said, what about we pivot from value-based care to value-driven experiences? And if we think about the emergence of these strong innovations in digital health and ask the question, 1, what problem are we solving? 2, what's in it for me? And that's the voice of the consumer. Because what I've learned in Las Vegas is about a give-get model. I give you something, I get something in return. What I believe we've been challenged by in the healthcare transformation movement is demonstrating to the consumers just in time, why is this valuable to them beyond the fact you have an app? So the notion of give-get. As an example, certain U.S. companies right now are stepping out on that leading edge. I won't call it the bleeding edge because healthcare, they're slow followers. And are saying, if you share your quantifiable step data with me, I'll pay you. United Healthcare is one example, has just been running public ads that says, if you report consistently your steps, there's a financial incentive in it for you. Because I think the everyday consumer, the word engagement, if there's value, we don't have to talk about engagement, they'll come. And so I believe that one of the areas of opportunity is focused around give-get. If there's value-driven experiences, something shared with each connected stakeholder, they will come and they will return. If we're having to use short-term transaction-based hooks like incentives, it's not sustainable. They have to see it as a part of the value that's experiential over time, and that's where I believe there's an opportunity for us all to look at, does our solutions complement, augment, or distract from how we're moving through life today? If I'm already in Facebook, can you potentially reach me there? If I'm already on LinkedIn, find out where those channels of opportunity are already that consumers exist and exploit that interaction. So that's one of the areas that I think is in front of all of us. So it's exciting to be here. I've traveled from afar to come to the Digital Health World Congress here in London and was quite impressed both with the lineup of speakers, participation. I was pleased that at some conferences that I've attended around other areas of the world, there's often gaps in seating. There's standing room only at almost every touch point throughout the 2-day event, which says great content, great connections, location certainly adds to it. But when individuals can take their time, the most valuable commodity we have, and place not just the registration fee, but place your time and the energy, the networking that I observed during this conference, the need that I hear stakeholders talking about is that we have a need. I'm from New Brunswick. I'm from the European Union. It says that we're all in this together, and we didn't have what I'll call a commercialization pitch to it. Business comes when there's an alignment of need and opportunity. So you come up with the notion that I feel that I could learn as a thought leader, but also share as a thought leader. Value can be driven from that. And I found this conference to be very high touch, inspirational, and one that I look to be involved with on future opportunities if appropriate.